Okay, Peter, so what we're going to work through now is just some of the self-massage sorts of techniques that we can get you to have a look at doing yourself at home. It's a great thing to do that breathing and exercise before you try any of the massage, because those things help to prepare for the massage and actually make any sort of massage that you're doing a little bit more effective. Okay. So what we start with is we're going to basically have a look at stimulating a little bit in terms of moving some of the fluid that might be sort of caught up into your groin. So we know that your left leg is the leg that you're having trouble with. So what we're going to start doing is actually just clearing out across this part of your, from this hip to the other hip. And we're also going to clear out with a few strokes from this hip up towards your armpit. So I'll get you to start by putting your hands over, basically down in the crease of your hip there. And we're going to get you to take a nice smooth stroke across your tummy like that. Beautiful. So it's a firm stroke, but it's not deep. So we're getting you just to basically bring fluid across from this groin where we know there's some damage to the lymphatic system, across to the other side there. Does that feel all right? So you can use one hand or the other, that's it, pushing with one hand and pulling with the other. Taking them nice and slowly. And really, with some of those strokes, actually getting into that lower part of your groin a little bit there too, wherever you might feel a bit more of the fluid being fuller or building up, get you to slowly and gradually bring that across. So once you've done something like 20 of those strokes from your left to your right, we'll get you started on doing some of these strokes up your body as well. So again, starting down in the groin, bringing that fluid up towards your rib cage basically. All right, Peter, so now I'm going to get you to do the massage down the rest of your leg. So to do that, we'll get you to sit up. You might be doing this on your bed at home or something like that, but just so that it's easier for you to reach the rest of your leg. Now what we're going to do is start with some of those strokes coming up from your knee, massaging nice and slowly, bringing the fluid up and around. Mostly bringing it up and around, probably towards your buttock more so. So essentially we sort of have this idea that where the lymph nodes have been removed right in your groin there, it's probably a spot where that fluid's building up. So we're getting you to take the fluid around to the other spots that we can. That's good. You're using a really nice smooth stroke there, using the whole of your hand. The other thing that we mentioned quickly as well is to do with moving fluid around scars. So I notice when we move a little bit further down your leg, Peter, we have to start looking at making sure we're not trying to sort of push fluid into a scar. We actually need to have in mind that fluid doesn't move very well through scars, and we actually need to come around them. Yeah, you're doing a really good job there, Peter, and what we've seen initially there with you doing the strokes from your knee to your, up to the outside of your buttock. We'd usually get people doing, again, that's something like 20 strokes, and then moving down into this section of your lower leg. Again, that idea of doing something like at least 20 strokes, you start to know what works best for you. So you'll know when you start to feel that your massage has had an effect. So massage is a great way, Peter, for you to be getting yourself really familiar with what's going on in your leg. It's also a really good way to monitor the condition of your skin, and lots of times people would use some type of moisturiser, whatever you feel works best for you, just to make sure we're keeping that leg nice and supple and your skin really soft and healthy, so that we're decreasing any risk of things like infections getting in there. The other thing I'll mention just with massage is that there are a few times when massage is something that we actually encourage you not to do. So we definitely get you to avoid any massage on skin that's being radiated, or on skin that you think might be at risk of having one of those big infections there.